Ovarian cancer has become an urgent problem for women's health all around the world. The difficulty of treatment is compounded by the fact that early signs aren't always obvious. Ovarian cancer is characterized by the uncontrolled growth of cells inside the ovaries. The cells can quickly multiply, invade, and eventually destroy human tissue. Ovarian cancer is usually treated with surgery and chemotherapy, although it's easier to treat if discovered early. That's why it's crucial that all women learn to recognize the symptoms of ovarian cancer and get treatment as soon as possible. Symptoms of ovarian cancer include the following in their early stages. 1. Abdominal bloating, distension, or swelling. 2. Satiety after eating a rather small meal. 3. Losing weight. 4. Discomfort or pain in the pelvis. 5. Exhaustion or tiredness. 6. Soreness in the back. 7. Alterations to bowel habits, such as constipation. 8. Repeatedly having to urinate. Women should be on the alert for symptoms that could indicate ovarian cancer and get checked out straight away, even if they are similar to those of other disorders. Higher risk groups for ovarian cancer include, for starters, let's talk about getting old. Ovarian cancer is more likely to strike older women, hence the disease is often detected during this time. Changes in inherited DNA. Inherited gene abnormalities likely account for just a small percentage of ovarian cancers, according to the available evidence. The BRCA1 and BRCA2 genes are two examples of those that significantly increase the risk of cancer in women. A third risk factor is a personal or family history of ovarian cancer. If ovarian cancer runs in your family, you may be at a higher risk of developing the condition yourself. Being overweight or obese is a fourth factor that can increase your risk of developing ovarian cancer. In addition, the painful disease known as endometriosis increases your risk because it causes tissue that looks like the tissue that lines the interior of your uterus to develop outside your uterus. Menstruation before the age of 10, menopause after the age of 55, or both, are all risk factors for ovarian cancer. Having a child for the first time is more dangerous than it is for women who've had children before, therefore that makes number 7.